Hello, everyone. This is Dr. Saud Anwar. Today is the 16th of April. It is about 1 a.m. I just wanted to have a conversation about this very important topic, and it's very relevant right now because if you would turn on the television or look at the newspaper, this is the conversation we are having, where there are people who are concerned about opening up the state and the country in this pandemic. And the question that is coming is, are we putting actually lives at danger for the economy? And there's a group of people and in public life who are saying, well, the economy is going to be a priority, and of course their policy recommendations would put lives at risk. So in this dichotomy that has been created in the conversation, it's worth looking at it in a little bit more depth with facts and science. And life with economy is what I want to talk about, but I would want to put life with economy, life instead of economy, and vice versa. And I think that's where our conversation should be. Why am I doing it now in the middle of the night? Well, I'm really getting concerned about the policymakers and the conversations that we are having in the country. Um, a couple of days ago, the Senate Minority Leader for the state of Connecticut wrote a letter to the governor, which was to try and open up the state for economic opportunities. And today there was actually a couple of days ago again, because the date has changed, it's past midnight. The Conservative caucus had written a letter to the governor asking the same thing, to open up the state. And this is um, and there's a political divide going on, and then the president has made a statement that he wants to open up the country on the beginning of May. So is it a political divide? Is it messaging? And I think it's worthy of an in-depth conversation to look at it with science, look at it with an understanding, look at the pros and cons of either of the options, and that's going to be what I'm trying to do. It's important to reiterate something that I actually put on Facebook today, was that we can learn a lot from the past. We don't have to create something again. But when we had the pandemic in 1918, when after the first wave of the pandemic, when things were quietening down, we are actually not even past that area. We are about here, and we're already talking about open the economy and then take care of this, at least in this region. But when the decisions were made at that time to actually start to celebrate and be happy that, oh, well, we have overcome a pandemic, after that, the second largest wave was so significant that actually led to thousands of deaths across the country. And I think it's important to learn from that. And then one more thing we can learn about is that Japan recently made a similar mistake. What they were doing was they were under pressure from economic perspective, and they opened up the country, especially after they had achieved success. And rather than staying the course of achieving the success, they actually opened it up, and boom, as expected, there was a significant surge in increase in the number of cases. So let's learn from the examples and experiences, and let's not become examples or experiences for others to learn from, because we are smarter. So that's why it's worthy to go into the depths. So this is a little busy slide, but it's worthy to start to look at this. So if we were to look at it from the, now look, this is going to, we have to follow the virus and the disease, and keep that in mind. Most of us will agree that saving lives is a smarter thing. Saving lives and protecting the lives of the citizens is a smarter thing from a policy point of view. When the virus emerges, there is a local and regional transmission. So that's important to look at, the local and regional transmission that is happening. And if you look at the state of Connecticut, the southern part of the state has had a very significant increase, and that's regional with the New York border. And the northeastern part of the state of Connecticut is in the path of this, but it has not reached the peak. At this point, we are in the initial phases right now. So again, different part of the state have different patterns, but they are all following. And I use the term internal amplification of the disease, which means that the disease is starting to spread from the internal presence of the disease, and I'm making this distinction, and it'll make sense in a second. This internal amplification is when the neighbors, communities, hospital workers, and the individuals who are in the same vicinity start to develop the infection. And this is where you can see part of New York is at this point. This is where you're seeing southern part of the state of Connecticut is right now. And after some time, there's a slow, gradual, thankfully, reduction in the transmission. And then this is sometimes when people start to be happy because they are not seeing the number of deaths, they're not seeing the number of new cases, and we start to look at the plateauing of the curve, and we are satisfied that we have been successful. That is when the pressure starts to increase and say, oh, let's open up the businesses, let's go and help the economy, and then we are sick and tired of being locked in our home. I understand the sentiment and I respect the sentiment. What we can learn, however, is that in China, what had happened was that when they had reduced the transmission, the people who were coming from out of the region were bringing new illnesses. So it was interesting. That's where the external spread started to happen. And I think that's why I separate them into internal amplification and the external spread or external amplification. So a time came when the Wuhan province had low cases or less cases than they had before. And then as a result, it's worthy to start to think about that aspect in the community because that would be there. The other challenge is that what we have, so this was the China 2020 that we have learned about the external spread that was coming over there. But the other thing we can learn from is Japan 2020 that I touched on in the beginning, that Japan started to open themselves up. And before you knew it, it's actually caused the resurgence of the same infection, if you will. Important to keep in mind. And USA had the same thing in 1918. So those things would be relevant for our conversation. So when we look at the pandemic, and I'm going to put on the prism of economic perspective, so there is an economic protection during the pandemic. This is, I'm calling this A, which is the economic protection during pandemic. And then B is somewhere around here when we actually are in this situation. This is the part where we have economic protection with the resurgence prevention. So there's a resurgence risk, and I think this is a part that we should have a little longer time on conversation around this, because this resurgence is what we are worried about. This is what we made a mistake in the past. This is what Japan had made a mistake in as well, but they have recovered, or they're in the process of recovering. And this is the risk that many of the public elected officials are asking us to do that, but there's a risk of resurgence, so we have to think about the process in a little bit more detail, and that's part of the conversation today. So the timeline, I think I've put this timeline, this could be inaccurate. This is based on learning from some of the other parts of the world. So the first A was the economic protection during the pandemic. And then the second was economic protection with resurgence prevention. And hopefully in about 2 to 3 months time after the first 2 to 3 months of the actual pandemic, we are hoping and praying by that time we should be moving towards the intermediate economic recovery, and then the long-term economic recovery. It would take about a year or so to move in that direction. So that's the timeline that I'm looking at, and this is based on some of the information that we are seeing in other parts of the world. China being ahead of the curve because for obvious reasons. Now, who are the people who are going to need help in each one of them? This is a partial list. The vulnerable individuals in general who are going to have an impact on job losses, which are unprecedented right now. Small businesses who are literally hurting. The medium-sized businesses are hurting. The large businesses who are actually the employers of individuals, and they are the source of a number of job losses as well, including the small and the medium-sized businesses. All of them are part of the spectrum that needs support and protection. So we need to have a protection for each one of those categories, and then we need a recovery strategy for each one of those categories as well, and a long-term plan that is going to be necessary. So I think this is the broad framework of what would be needed if we are to look at this. Right now, we are in the protection mode. Saving people, saving jobs, saving the opportunities, and reducing the risk of resurgence. So It's going to be challenging for the federal government, it's going to be challenging for our state government, and it's going to be challenging for our city and towns as well. And that's where we are expecting the federal government to help the state, and we are expecting the federal government to also be a support to the towns and the cities as well. And that was one of the letters we had just written. The increased expenses are part of the challenge that all the governments would have, because the number of unemployed is going to be increased, the support to the vulnerable is going to be needed, the small business, medium-sized business is going to be needed. We will need a stimulus package that is already in the works, but we will need many more, looks like, from the way things are going to go going forward. So that's part of it. And of course, there's going to be decreased tax revenue, and the debt burden is going to be increasing. So those things are going to cause the imbalance within the various governments, primarily the federal and the state more so, and in the town governments as well. So that's requiring us to be strategic about how do we approach this, and then try to minimize the damages that are anticipated from this viral infection and the pandemic. So at the public level and the private level, there will be different ways people can get the support, the federal government, state, and the town. But the federal government, the central government will have to reprioritize. We will have to start to make our priorities focus on the states, focus on the towns, and the country inside, rather than some of the other priorities we've traditionally had. Um, so that's going to be important. And this interest rates, we have already down to as low the interest rates we have seen in the last many years, but we may have to get to the point of starting to print money as well. And I'll touch base on this a little bit more, because there's a downside to it as well. The banks, the funds, and the investors would have to come in. We'll have to have public-private partnership in the stage C and stage D, which is the short-term recovery, and the long-term recovery plan will need public-private partnerships. There's no other way that we would be able to be successful. This would be an opportunity for some of the private industry to be able to make a lot more profits going forward, and this is something that they should look at, an opportunity for investing into the country's infrastructure and rebuilding some of the systems which have partially collapsed or are at a risk of collapsing. So anticipated changes in priorities and actions. This is going to be important, because this is unfortunately going to be our reality. The government would have to have spending reduction, the businesses would have to have spending reduction, and the individuals. We are already seeing that pattern. What do we spend the money on as individuals? We spend the money on goods, we spend the money on services, and we spend the money on financial assets, whether that is real estate financial assets, or it is investments, or it's stocks and so on. But obviously the people are going to have to prioritize where they're going to be investing. I think that's why the markets are showing the impact that we have seen. The service industry would be some of the necessary service industry, of course, and that is where a lot of people are employed within the service industry. They are going to be at a risk of losing jobs, and then of course the goods and the things that we need on a regular basis. The reduction of debt, this is an opportunity because of the market and the interest rate being so low, that people will have an opportunity to reduce their debt and restructure their debt as well, because this would be a time to look into that. This would not necessarily be right away, but this would be during this stage C and maybe D that we can look at. Every time there has been a recession, it is important, and it has happened everywhere. The rich have to give to the poor. This is redistribution of wealth. This is the anywhere in the world, in the history of the world, in the economies, this is the way to be able to approach this. I'm not saying anything new before people panic, but this is what has happened every time there's a recession in a situation like this. This is a global impact with the pandemic, so this is going to be necessary. Printing of the money is something that the federal government does. Keep in mind, this is the federal government's thing. Don't start to do this at home yourself. So the balance is going to be critical. This can backfire. There's an increase in inflation if it's done in an uncontrolled fashion. It has been done in the past. In 2008 it was done. In the 1920s and 30s it was done as well. And significant amount was done. And we are going to be doing the same thing in the United States. But if we are going to do that, it has to be done in balance and coordination rather than a random way, because inflation risk would put us at a higher risk for other complications going forward. So this is to be looked at. But this is how there will clearly be a priority changes that we will see in the actions at various levels. So one thing is very basic that we should never forget, because now we are talking about economy and the future of economy, and where we should have to put our resources and efforts. What wealth is created based on what is perceived to be of value. Let's think about this again. So there are buyers and there are sellers. So wealth is created when somebody perceives something to be of value. Now, based on what we are experiencing right now at this time, our definition of what is valuable has changed, and our definition of valuable has what is valuable has changed compared to about 3 months ago, or 2 months ago for that matter. So and 2 months from now it's going to even change further. So keep that in mind. That is going to help us know which direction, what investment, what industries we have to look at and then focus on. So in simplistic fashion, in order for economy to survive, you have to have a buyer and you have to have a seller. So that's going to be the key thing. The buyer has cash and the buyer has credit. That's where they are able to pay. And then if they are going to be able to do this, they would be able to buy goods, they would be able to buy services, and they would be able to buy financial assets. So those are the sellers, and then these are the very basic things. So in your mind, start to look at what services would be critical. And then, so right now, the credit is going to be easily available potentially because of the low interest rate. The cash is actually not as easily available, so that's going to be a challenge for people right now with the opportunities being less. So services, what services are critical for survival? Do we need financial assets? What do we invest in? These are the priorities that are changing and shifting for individuals, for businesses, for communities, and that is why it is important to look at this and start to look and plan a future going forward of where you anticipate things to be for yourself, but also for your businesses, also for your community, and if you are in a position of policy making, that's going to be something we will have to look at as policymakers. So priority sectors and mind shifts post disaster. I think, and this is again how I'm seeing this when everything is done, this is stage D, and if you will, when we are in the mode of recovery, we will be putting more resources into self-reliance. Why? Well, we learned from the PPEs that we can't even make masks, we cannot even make protective equipment in United States, and we need to actually start to have self-reliance on many of those things, because the supply chain management, and this is the vulnerability that we had and we did not predict it. Local control and management is going to be important. While we have always been focused on globalization, I think our initial reaction, in my opinion, rightfully, may be away from globalization to be moving towards self-reliance, and then trying to make things in-house, trying to make things so that we are not dependent on another country, another supply chain system to be able to be caught in the situation that we have been in. Local planning for our food, having increasing agricultural support. This is a vulnerability that we have always looked at, and then we are clear that that is going to be important. We need to make sure that the rural support systems that we have, the food growth systems that we have, the local agricultural support, we will have to invest and make it robust for our communities so that our security about food will be protected in every region of the state and the country. We actually have already learned who is essential, and I'm just going to read what I just wrote. Was essential will be essential and paid as essential. What I mean is that we have recognized who are the essential workers, and we have also recognized who are the essential workers who need to be respected and supported, whether they are working in a supermarket, whether they are collecting our garbage, whether they are at various levels, and of course the healthcare workers goes without saying. So that's the part that I think will have to be very important for us to recognize and identify a way to support and recognize and make them essential. Telemanagement, one of the things that's going to change, and it has already changed our society, is that we did not realize so much of work could have been done by management, and then that's something that is going to be here to stay going forward because of the efficiencies that are there, and then of course the culture change that may happen because of this. Healthcare and innovation and public health infrastructure, it is clear we could have done better, and this is why it's going to be something that we will be investing much more effort in: education, training, planning for healthcare infrastructure and public health infrastructure. Inpatient, this is going to be important. In-person service areas will become more valuable. Our police department, our healthcare, our fire departments, these are the people who are frontline helping out in-person services that are needed, so they will get more stronger and supported. They've always been, but we will recognize that there's a need to have a stronger protection there, and there will be more job openings going forward in these sectors, in my opinion. The high-risk industries, unfortunately, as of right now, are cruise lines. Maybe when they have recovery over a year or two from now, things may change, but right now it doesn't look promising. Airline industry has been hurt very hard. This is an essential industry. We will have to figure out a way to support it at the federal level. Retail industry has been going through so many challenges, and this would be one more added insult to the retail industry, and it's just sad because that would mean the malls are going to be negatively impacted. That's going to be a negative impact on the regions as well. Entertainment with close proximity areas, that's going to be a challenge as well in the intermediate time. Maybe during the later part of recovery, this will be something that may improve as well. So these are some of the things that come to my mind right off the bat about how do we reassess and what would be the areas of opportunity. Back to what we had said earlier. Remember, I had said about the pandemic and what we need to do. This is where the challenge right now we have. We may be moving in this direction for the reduced transmission, and we may be at a risk of getting to the external spread in our region or the internal spread, and there was a risk that it was going to cause internal amplification. Or it could be reduced transmission after we open ourselves up. There's going to be a risk for recurrence and internal amplification as well. So this black circle is the area that I have put in, and this is where we need some policies right now, because of course our fear is that the pressure from the federal government, the pressure from internal groups, including the couple of letters that we have received, are going to make our governor or our state make a choice which we will regret, since there's no clinician or anybody with hands-on management of this. That's why I'm doing this, to make sure we understand what is going to be the risk going forward. So with this, we need to have a little bit of an assessment plan for how do we do this. The risk scoring would be based on how do you do this, and I think this is going to require us to have far more involvement. So this would be a risk scoring for individual business, institution, or a community, or a town, or a region, and even an office. If it's a town's office or a state office, what would be the risk scoring system? How do we identify, is it safe to open it up? What would be the way to have people come back to work over there? Is this going to increase the risk of resurgency of the infection? And that is why we will need to figure out a strategy. So this is the number B that I had said about the resurgence risk situation. That is something we have to look at. So what would be the questions that we have to look at? The variables that will help us out in making good decision is the workforce, the consumer density. Again, how many people are going to be there? How many people are going to come to this place? Are they going to be within 6 feet of each other? Is this going to make the people coming in buses or a situation which is going to increase the exposure? What would be the access? Are there people coming from out of state in this area? Is this going to be an opening which is going to result in people from a high infection area to come to in the area where the infection is decreasing? So that is going to be a question to ask. Are the people in that facility able to function with safe distance? If that's not possible, then you don't want to do this. Why are we going to put the resurgence risk? Is there availability of hand sanitizers? Right now, many of the companies are already saying, oh, we don't have hand sanitizers, so we don't want that to, and change the policy. Interestingly, the CDC is changing their policy every few days on some of these aspects, and healthcare workers and people are getting consumed and confused with what's going on. So we don't want these policies to be changed for the benefit of the company at the cost of the workforce. I'll repeat this. We cannot allow to change the policies for the benefit of the companies at the cost of the workforce. Because if the workforce gets unwell, we are actually not helping the company, and we are not even helping the local community, and we are causing the resurgence of the illness. So availability of hand sanitizers, masks, and dedicated personnel cleaning the surfaces. So can we provide those kind of services to be able to help the people out? If we can, if we can actually have the dedicated personnel be able to provide the surface cleaning and the masks and sanitizers, then we are talking about something that can be achieved. What are the risks and activities that would place the risk of transmission or increase the risk of transmission? So if people are going to actually, at that workforce, are going to be working so closely in an environment where they can transmit the disease to one another, that would be something that we have to be cautious of. Are we able to have surveillance testing, the people of asymptomatic people with the PCR testing for the nasopharyngeal test for the presence of the active virus? We can't even have that test right now. It's not as easily available. But if we are going to move in that direction, we'll need surveillance to be in place. And we need to have surveillance of antibodies, because if we feel that there's enough herd immunity, well, let's prove it with some tests. If you cannot prove it, then we are actually putting people at risk and taking a very dangerous step in a direction where we will not have the capacity to manage them if we get everybody back to work. So those are the common sense things that one has to look at when they're going to assess if a business should open, if the a place is going to open which has got a lot of workforce, and then identifying strategies around the protection. So surveillance is going to be important to be able to assess if there's enough infection out there or if there's enough immunity out there. So those things, along with the other common sense things that I mentioned, would help people, whoever are going to make those decisions, to look at those decisions rather than make it a political stand that, oh, we want businesses to open. Well, yeah, of course, but we don't want to get people to sick. So let's use some common sense approach, and that's what I am hoping this should be able to help us with. Again, remember this slide. This is where I started. Make good choices, because our choices can result in the well-being and lack of well-being, including death of our fellow community members, our citizens, and our friends and our neighbors, and we have to take this seriously and respect this fact as well. And we can do this in a smart fashion. So with that, I wanted to say thank you for listening. It's a little longer than I expected, but it's worthy. So